Good evening, ladies and gentlemen, and welcome to the 2018 Griffin Gala at the exciting Quarry Walk. Much like this development is growing into a literally groundbreaking design for a town center, Griffin Health has changed the face of healthcare for more than 100 years and is now setting a standard for delivering care to its community. Please enjoy this enlightening story of Griffin's evolution to an industry leader in innovative healthcare. From its opening in 1909, Griffin Hospital has always focused on meeting the healthcare needs of its community. In those first 50 years, the Griffin community needed high-quality care close to home, and Griffin responded by growing rapidly from 24 beds to 225 beds in 1968. In the 1970s, Griffin brought revolutionary breakthroughs in surgery to the community with the launch of its same-day surgical program. Later in that decade, Griffin provided better access to primary care physicians for families in the rapidly growing city of Shelton and surrounding towns with its Family Health Care Center. Sensing the need for improved pre-hospital care in the community, Griffin played a major role in developing the state's first paramedic intercept service, Valley Emergency Medical Services, which set the standard for pre-hospital care across Connecticut. In response to a growing demand for maternity care in a less institutional environment with fewer restrictions, Griffin opened its 14-bed childbirth center in 1987. The center foreshadowed the future of care at Griffin, responding to things that mattered to patients. Open visitation hours, a strong focus on education, and a home-like atmosphere. Following the success of the Childbirth Center, Griffin realized the need to redefine the hospital experience so that care is centered around the needs of patients and families. In 1992, Griffin became the first member of the new Plaintree Hospital Affiliate Network, which is committed to empowering patients to be active participants in their care by providing access to information and eliminating barriers to facilitate more interaction between patients and their caregivers. Countering the beliefs of many in the healthcare industry that hospitals should be designed to meet the needs of the caregiver, Griffin opened the 100,000 square foot North Wing in 1994. The first facility of its kind built from the ground up, consistent with Plaintree's healing healthcare design principles and patient-centered care. The North Wing featured soothing environments and work areas that promote human interaction and comprehensive care. In 1995, Griffin added to its unique preventative healthcare education model by partnering with the Centers for Disease Control to establish the only hospital-based prevention research center in the country, developing innovative approaches to health promotion and disease prevention. 4 years after opening the North Wing, Plaintree became a member of the Griffin Health Services family and relocated its headquarters from San Francisco to the hospital's main campus in Derby. Griffin's award-winning healing environment designed to facilitate meaningful interaction between caregivers and their patients, combined with a culture of mutual respect, support, and pride in the delivery of exceptional patient-centered care, along with the organization's demonstrated commitment to caring for the caregiver, prompts Fortune magazine to designate Griffin one of the 100 best companies to work for list for the first time, an honor Griffin will receive 9 more times after that. The turn of the century saw tremendous growth for Griffin as it expanded its facilities and improved its capabilities to better accommodate the ever-changing healthcare needs of the community it serves. In 2003, Griffin opened its newly renovated 14-bed inpatient psychiatry unit, applying its Plaintree-centered principles to behavioral health care, setting a new standard for a psychiatric unit. 5 years later, Griffin and the Lower Naugatuck Valley community worked together in the successful Breaking New Ground campaign, collecting $5.5 million to build the award-winning Center for Cancer Care and Hewitt Ambulatory Care Pavilion, bringing the full spectrum of cancer treatment and support services together in one location for patients in the Lower Naugatuck Valley. The same community spirit inspired the creation of the Hewitt Center for Breast Wellness with its leading-edge breast imaging technology and rapid diagnosis service. Griffin answered the call for increased capacity, greater privacy, and more efficient emergency care by renovating its emergency department and expanding treatment space by 50%. Griffin rounded out the decade of patient-focused growth with the Imaging and Diagnostic Center at Ivy Brook in Shelton, a warm and supportive outpatient environment dedicated to improving the health and well-being of individuals. In 2009, Griffin marked 100 years of serving the community. Just as it revolutionized inpatient care in its first century, Griffin is now reshaping the way healthcare is delivered by adopting a more proactive approach to improve the health and well-being of individuals that live and work in our community, designed to prevent disease and, when it occurs, manage it more effectively in order to reduce the cost of care and improve care quality. The innovative shift to value-based population-level healthcare requires the development of new capabilities. Griffin reaches into the community through the Center for Prevention and Lifestyle Management to promote preventative health and lifestyle changes proven to identify health risks before they develop into serious illness. The network of Griffin-affiliated providers has steadily grown over time. Today, the Griffin Faculty Physicians is the largest group of primary care physicians, specialists, and licensed independent practitioners in the Valley, and are leading efforts to integrate population health and office-based medical care. Similarly, Griffin's Physician Hospital Organization, or PHO, brings together area physicians that are members of the hospital's medical staff in accountable care arrangements to provide coordinated, high-quality, and low-cost care. The hospital and participating physicians are responsible for the well-being of more than 13,000 individuals in the community. This new age of healthcare partnerships also inspired Griffin to spearhead the formation of the Value Care Alliance, a collaboration of high-quality, lower-cost Connecticut health systems committed to providing health care to consumers and health insurance companies with a lower-cost alternative to the expensive and uncoordinated care provided at tertiary referral centers. What does the future hold for Griffin Health? Please join us in the dining tent to see what the next generation of healthcare will look like.